That's why we are here today to talk about the urgent need for bold statewide action, to learn from leaders who are stepping up, and to inspire all of us, health professionals and advocates, to use our voices to push for the policies and protections our communities need to stay safe in this rapidly warming world. It is my pleasure to introduce our panelist. Our first speaker, Dr. Lisa Patel, is a pediatrician and the executive director of the Medical Society Consortium on Climate and Health. Lisa is a nationally recognized leader working at the intersection of health and climate change, advocating for stronger policy action and empowering health professionals to speak up for climate solutions that protect health. Lisa will share more about the Alliance's background and the health impacts of extreme heat. Our next speaker will be Grace Wickerson. She's a senior manager for climate and health at the Federation of American Scientists. Grace's work focuses on leveraging science and policy to advance health-centered climate solutions, with a special emphasis on protecting communities from the growing risks of extreme heat and supporting strong state leadership. Grace will share details about the policy recommendation from our joint sign-on letter. And last but not least, we are honored to have with us Dr. Eugene Levar. He's Arizona's first ever chief heat officer working within the Arizona's Department of Health Services. He brings years of experience advancing environmental health, heat preparedness, and climate resilience across the state, helping to coordinate cross-agency efforts to protect Arizonians from extreme heat impact. He'll highlight Arizona's leadership on heat resilience. So after we hear from all the speakers, we're going to have some time for a moderated discussion, and we will also take some questions from our panelists, from our audience, sorry. And without any further ado, I'd like to call Lisa, who is our first speaker. Lisa, please take it away.
Okay, thanks so much for having me. So my name is Lisa Patel. I'm both the executive director for the consortium. I'm also a clinical associate professor of pediatrics at Stanford School of Medicine. And first, I just want to tell y'all a little bit about the Alliance for Heat Resilience and Health. So a number of organizations, national organizations, came together last year when the Occupational Safety and Health Administration introduced a new rule to protect workers from extreme heat. We use that as an opportunity to mobilize health voices around ensuring that we were providing rigorous public comment. And we also had a sign-on letter that was joined by over 80 organizations. We were able to get really great public comments in, and we built from that into the next phase, which was understanding that federal leadership for heat has disappeared. It's very important for us to turn to state-level solutions to ensure that populations remain safe. So the Alliance includes the consortium, includes nursing, public health, lung association, many major national organizations working together to ensure that we're enacting plans for safety that are evidence-based and grounded in the health of populations. I think if you're joining us, I don't need to tell you too much what a issue extreme heat has always been. Heat has been the number one weather-related killer. We expect that to get worse as the impacts of climate change grow worse. We know that these deaths are often an undercount. And so as a physician, we don't often have ICD-9 codes. It's often not, extreme heat is often not listed as a reason on a death certificate. And so a lot of these deaths are people where, for example, an elderly person was found baked to death in their home, or an unhoused individual was found out on the street during an extreme heat event. But we know that the impacts of extreme heat carry much farther than that. So these numbers are an estimate, but we believe it's a vast undercount from the actual deaths. So as we think about extreme heat and health, we'll have Dr. Levar talk to us more about Arizona, but I do like to just raise a few stories as we think about what these impacts are. This is a man in Phoenix, Arizona, who stepped outside onto the sidewalk when Phoenix was experiencing multiple days of extraordinarily high temperatures. And so that pavement absorbed the heat and held on to it. He stepped outside. It was a hot day, got dizzy, and fell onto that pavement and sustained a second to third degree burn from it. I work as a pediatric hospitalist. This graphic in the center is when in Livermore it got to 116 degrees. I worked two 24-hour shifts over Labor Day that weekend, and they were some of the busiest shifts I had, including during the pandemic. I was seeing more pregnant individuals coming in with various birth complications and turning premature labor. And we were seeing more children that were coming in with asthma exacerbations. And then here on the right is just a heat map of what the US looked like last summer in the middle of heat of our summer in terms of how many parts of the US are really baking under this extreme heat. In terms of what this looks like in the hospital, this was reporting that came out of the Washington Post during the Oregon heat dome event. Physicians raced to provide fluids to patients who arrived breathless, dizzy, and drenched in sweat. Others were brought in on stretchers, their body temperature so high their central nervous systems had shut down. Those who could still speak told of stifling apartments and sun that made their skin sizzle. Some had tried to walk to county cooling shelters only to collapse in the blistering heat. We've done studies on what the human body can handle in terms of heat, right? There are limits at which our bodies were not adapted for this. And the studies generally show that our bodies can, if you're a healthy adult, you can handle 115 degrees with minimal humidity at rest, drinking water continuously. Think about how many of those conditions have to stack up to mean that you can handle it. And we know we're busting through those temperatures in many parts of the world already. And we are and our warming is getting worse because we're continuing to drive more emissions into our atmosphere. How does this happen? So as our body starts to heat up, we need a very specific temperature for everything within our bodies to function and to operate. And so keeping to a certain temperature, we invest a lot of energy in that. So if it starts to get hot outside, things start to get too hot inside. We start to pump our blood to our skin. And we do that to engage in evaporative cooling. It's basically like a big sprinkler system. But what happens if it's so hot outside that no matter how much you're trying to sweat, you can't cool yourself off inside? Well, that's the only mechanism your body has. So you just keep pumping blood out, blood stops going. You start, routing it away from your other organs like your brain, your liver, your kidneys, and it all is going out to your periphery to try to cool down. So if this carries on and on, you drop your blood volume, your heart starts beating faster. For a person that already has a weak heart, it's a risk for heart damage. And then eventually you can end up with end organ damage. And the thing you're trying to prevent is heat stroke or death as a result. There are multiple health issues that we see as a result of extreme heat. As I mentioned, we are seeing more deaths, but heat also drives more strokes, more heart attacks. I mentioned premature birth. There's also good evidence for low birth weight infants, which really can affect the lifelong of a child's health. Kidney damage and kidney failure. I work with emergency medicine doctors who say that they will have outdoor workers come in frank kidney failure because they've taken multiple hits to their kidneys from working outdoors, and then they don't seek care until they're really at the point of needing dialysis. Mental health issues. So during periods of extreme heat, we see increased violence, increased suicidal attempts, increased interpersonal violence, poor sleep, and then respiratory issues like asthma in adults. Finally, I just want to say a note about vulnerable populations that require special attention. And so infants in particular are more vulnerable. So it's become a standard part of my counseling to make sure families have access to air conditioning and can pay their air conditioning bills. Unfortunately, we're also seeing more black and brownouts. So that's also become part of my counseling. What do you do when it's baking hot outside and there's a blackout because everyone is trying to access their air conditioning at the same time? Outdoor workers, as I've mentioned, a farm worker is 35 times more likely to die outdoors during a period of extreme heat. Unhoused, we have a housing crisis in this country, and the unhoused are particularly vulnerable, incarcerated individuals, and the elderly. All of this is to say we have a lot of work to do to ensure that our entire populations, but particularly vulnerable populations, have safety mechanisms in place. And with that, I will turn it over to the next speaker.
Amazing. That was such a good remark and great grounding into what actually heat is, and not just um, a phenomenon we're seeing, but also real consequences to people's health and their bodies. So Thank you so much for that. Hi, everyone. My name is Grace Wickerson. I'm Senior Manager for Climate and Health at the Federation of American Scientists. Who we are, we're a policy think tank based in DC, and we're focused on bridging the gap between science and technology expertise and policymaking. We do this at the national level, and we're also looking at more opportunity to translate this expertise to the state and local level as well. I've been working on extreme heat here for about 3 years, very much trying to figure out like what's the what here in terms of the policy interventions available to us to really start to crack this problem and work towards a more resilient nation. Some of our work has been, crowdsourcing policy ideas from hundreds of experts, designing convenings through which we can um, assess these policy ideas, their feasibility, their implementation technicalities, and really work to find that the best ideas that will make the most of the impact that we're seeking. And our work has culminated in a couple of big coalitional products. One of the ones that I'm pretty proud of is our 2025 heat policy agenda, which was focused on a national federal heat policy strategy. So just a bit of like context about us and what we do and our work to date. Um, I think just again to really drive the point home, what we know is yesterday's extremes are today's forecasts. Heat that we know is once uncommon in many places is routine and now longer lasting. For example, the Pacific Northwest, the Midwest, the Mid-Atlantic, and New England smashed their early season temperature records this year, seeing 115 degrees, which is wild in some parts of the country that are just not used to seeing that level of extreme heat. We even know that Alaska, a state not known for extreme heat, had to issue its first ever heat advisory. So this is a big national problem, and every state has an extreme heat risk that they're going to need to figure out. And they're going to need to figure it out quickly because more of what we're also seeing nationally is pointing to a greater emphasis on states taking responsibility for disaster management and emergency management. And so the common sense solutions that we're thinking about are about how to get, that preparedness underway to meet this moment, which is really an upheaval of the system that we've seen to date in terms of the management of hazards and disasters. And so this letter is really built in a common sense framework for how we can think about getting ready for extreme heat. And the real emphasis here is preventing the impacts before they happen and preventing the costs, which is an immense focus of all kinds of emergency and disaster management and public health approaches. And so we hope to set that up here. And I think the four recommendations that I'll dive into and that we worked on along across the Alliance, but also have been backed by conversations with experts and with local and state policymakers are just the importance of knowing the scale of the problem. In many parts of the country, there's not a robust system of health surveillance, as Elisa was flagging, to know the heat-related illnesses, the deaths, the economic costs, the social disruptions, the livelihood disruptions. And without that baseline of the impacts, it's incredibly hard to even design effective policy and really know what you're working with in terms of the targets you're seeking to achieve. Having a goal for where you want to go, it's impossible to do that if you don't know where you're at. Another big thing that we emphasize in this letter, and that is, I think, so important, and you'll hear about like why this is so important when Eugene speaks in a few minutes, is that you need a leader. You need someone who's responsible for this issue. We know that heat is a multidisciplinary problem and a lot of different sectors have an input. But if no one is responsible for the issue, the buck will be passed. And so how to emphasize that there's a need for someone to be bringing the people together and authorities that allow them to actually execute on the key things that are needed. And that is then kind of the importance of that recommendation about planning and preparedness, knowing who is in your court, who you can leverage, and how they can be working on both the short-term responses as well as a long-term strategy. And those are the two I'll close on. Responding in the moment. Extreme heat is here and it's coming and it's impacting our systems, it's overwhelming our grids, and it's overwhelming our healthcare infrastructure. And so if a heat is going to come and is going to impact, we need to have a strategy for response. And that might be, various kinds of protocols that we've seen across the country. But even thinking about how to declare it actually as an emergency and knowing that emergency authorities at the state level can unlock various funding, various regulatory waivers, and other authorities that just are not possible without those declarations. And the final thing I'll mention is just the long-term strategies to actually transition our infrastructure for the climate of tomorrow. I like to say all the time, our infrastructure was built for the 1900s. It's not built for the 2100s. And so we have to really think about a transition to adaptation and resilience and think about the levers available to us to actually move our infrastructure in the direction that we want. And so we highlight a few examples in the letter, thinking about the benefits of smart surfaces like cool roofs and cool pavements and trees and urban greening infrastructure that bring the temperature down, as well as common sense strategies to be implemented in the workplace to avoid the costs that we're seeing grow as more and more workers are impacted by heat on the job. So that's just a snapshot. And I think really to just close, we are really excited. There's a lot of growth in extreme heat work happening at the state level, and that's something that as FAS we are facilitating and in good conversation with, and just excited to continue to support it and know that that is a space of strong innovation and opportunity in the years to come as we really start work to build a more heat-ready nation. So with that, I'll cede my time and excited to hear Eugene kind of emphasize the importance of this work in Arizona.
Good morning and afternoon, everyone. Today, I have the opportunity to discuss the critical public health issue of extreme heat and how Arizona is addressing this challenge. So we'll explore our efforts in context of the Alliance for Heat Resilience and Health Extreme Heat letter introduced by Grace just a few minutes ago. Extreme heat is no longer a localized problem, as you heard mentioned. It's a national public health emergency, and its impacts are rapidly worsening across the United States. Arizona is unfortunately on the front lines of this issue, along with many other states, and our experiences may offer some useful insights in that context. Next slide, please. Beyond the general impact, let's delve into specific health harms. High temperatures are directly cause heat-related illness from exhaustion to stroke. It has the potential to significantly worsen existing conditions such as heart, lung, and kidney disease, and sadly can increase the risk for adverse birth outcomes, as you heard earlier. And we also see vulnerable populations like the elderly and those in poverty or rural areas are particularly at risk with disrupted healthcare access. Certain medications can interfere with your body's ability to stay cool in hot weather, leading to dangerous overheating. And it's also important to remember that high temperatures may also degrade medications, reducing their effectiveness. Furthermore, the drivers behind rising temperatures can contribute to increased air pollution, specifically ground level ozone, which has a wide range of harmful effects on the respiratory and other bodily functions. Next slide, please. The impacts of extreme heat extend far beyond direct health effects, permeating our economy and infrastructure. We know some of the most vulnerable, including outdoor workers, people without reliable cooling, children, and the elderly, can be really impacted by extreme heat. Considering that 36 million US employees face heat exposure at work, I believe nearly 1 million Arizonans work in heat risk industries. And a quarter of US households struggle to pay energy bills as of mid-July. And the Arizona Department of Economic Security shows that since October 2022, they've received nearly 136,000 applications for the Low-Income Home Energy Assistance Program and distributed over 77 million in assistance based on those applications. Economically, extreme heat contributes to the escalating cost of living, focusing and forcing difficult choices for many families. The broader economic costs are staggering, encompassing decreased productivity, agricultural damage, and increased wildfires. In 2024, the estimated cost was $162 billion nationally. And also in 2024, nearly $12.8 billion in Arizona alone. This, coupled with the increasing demand for heat-related care, places significant stress on our already burdened healthcare system. Arizona and many other places These impacts translate into significant economic cost. We faced increased healthcare expenditures, the loss of productivity due to illness and work disruptions, which affect not just individuals, but the wider economy. This graph shows here, and it indicates the hospital costs have increased in our state over time, pretty much exponentially. Next slide, please. Our state is a prime example of being on the front lines of the heat crisis, experiencing persistently elevated temperatures and unprecedented heat waves. Heat-related deaths in Arizona were 990 in 2023, but we saw our first decrease from preliminary data in 2024 with 976, which is the first state-level decrease in heat-related deaths since 2018. This is likely due to the great work being done by city, county, weather, utility, community, and faith-based organizations and other state heat partners across the board. Nationally, healthcare costs related to heat illnesses are already at $1 billion a year, and in Arizona, nearly 38 million in 2023, a number projected to likely rise as summers intensify. We're also experiencing an escalating burden with increased 911 calls and ER visits, and this strains our healthcare system, which already faces staff shortages, rising costs, and unequal access to care in some areas. Next slide, please. The Alliance for Heat Resilience and Health letter outlines 4 key policy priorities for states. The first is to launch a statewide assessment of extreme heat impacts and invest in robust health surveillance systems. The core idea here is that you cannot improve what you cannot measure. Better tracking allows us to understand the problem and assess our solutions, and we definitely need data for action. Arizona has been actively engaged in this. We have ongoing surveillance with heat-related illnesses and deaths, collaborating closely with our local health departments to collect and report this crucial data. We're also working on making this data more accessible through relevant public-facing reports and dashboards for heat-related illnesses, deaths, county heat tier notifications, and much more. But there are best practices and great efforts happening all over the US, including other states like California that have pioneered assessments revealing significant economic and mortality impacts in their state. Next slide, please. A second priority is to designate a statewide heat lead and develop a whole government extreme heat plan. Arizona established my statewide chief heat officer and a state heat relief coordinator position in 2024. These designations help provide coordination and single points of contact around efforts and communication. And Arizona plays a vital role in supporting the integration of public health strategies into the state's broader heat plan. We also hold and participate in numerous interagency efforts, ensuring a holistic approach to heat preparedness and response. And a critical aspect of this planning is developing emergency playbooks that include scenario planning for worst case scenarios like widespread power outages that you heard mentioned during heat waves with our sister agency, the Arizona Department of Emergency and Military Affairs, and others. Next slide, please. The third priority urges states to consider extreme heat as a state of emergency to mobilize needed resources. Arizona has indeed taken this step, elevating extreme heat to a statewide emergency in 2023 through Governor Hobbs' executive order seen here. Recently, Governor Hobbs also issued an executive order for protecting Arizonans from heat risk in the workplace, establishing a task force to tackle this need. These designations are powerful because it allows our state to prioritize and deploy essential resources to achieve defined tasks. It can possibly enable measures like developing plans, preventing utility shutoffs, ensuring power grid stability, and dispatching additional emergency medical personnel to addresses and areas where there is an increased demand. This is particularly vital for areas that may lack local capacity in times of need. And we also advocate for federal recognition of extreme heat as a major disaster, which could possibly unlock further assistance from FEMA and HHS, and also appropriate light heat allocation for our state. Next slide, please. Finally, the fourth priority is to develop strategies to finance and plan for long-term extreme heat impact reduction. The increasing temperature records and continuing heat-related deaths underscore the need for innovative, forward-thinking solutions. Arizona supports and promotes long-term strategies, including emphasizing heat protection for state employees and advocating for workspace safety best practices through our Industrial Commission Heat Stress Emphasis Program. We also champion the integration of passive cooling strategies that you heard mentioned into infrastructure development, such as planting trees, creating green spaces, and utilizing cool roofs, which reduce experienced heat and lower energy costs. Furthermore, like many of you, we actively seek the support of federal funding for long-term mitigation programs and encourage the private sector to invest in heat risk reduction. Next slide, please. In conclusion, Arizona, through the dedicated efforts of statewide heat partners, is demonstrating a proactive approach to extreme heat that aligns directly with the Alliance for Heat Resilience and Health's urgent call to action. We are committed to understanding the scale of this problem, readying our systems, and developing robust long-term strategies to mitigate heat-related impacts. As the letter emphasizes, the most effective way to prevent deaths and economic losses is to act before heat hits. State-level action is urgently needed, and Arizona is stepping up to the challenge. By continuing to implement these priorities and policies, we are working to diligently protect the lives and ensure a healthier future for all of Arizonans. Next slide, please. Thank you so much for the opportunity to go over some of the areas action. And if you'd like to see some of our resources that we have available, please feel free to visit the web address you see here of heat.az.gov. I'll hand it back. Thank you.
Thank you so much. That was a great presentation, and we are so fortunate to have you here, Dr. LeVar, because you just went over all the 4 priorities of our letter and what we want other states to model and do. So we have a couple of prepared questions that I'm going to ask. I'm going to put a spotlight on Lisa so we all are here, and then we can get started. All right. So this question, my first question, is for all of the panelists. So please see who wants to go first. What do you see as the greatest areas of need or opportunity in how states are currently responding to extreme heat?
Oh, I'll do it first. I'll go. I think what I am really focused on is empowerment. I think there are a lot of people in state governments who are seeing the challenges of extreme heat, maybe not in this full holistic picture Eugene presented, but they're seeing this threat come up and they're seeing it present. I think to be empowered, though, would be to be like, okay, we are taking this as a priority. We are acting on this. We're putting our resources to this. We're putting our people to this. We're looking into regulation. We're looking into incentives. We're going to take this on and we're going to move forward and we're going to all figure out how we can do this. And I think that's really evident in the Arizona example to really see the ways that, the governor has stepped up to say, this is an issue for Arizona. This is something we have to do, and we have to all do it together. And then bringing, folks like Eugene and also Maren Mahoney, who's the Chief Resilience Officer for Arizona, to really be like, and we're going to drive this forward together. It's to see that partnership and to see that collaboration. And that also then moves downward as well. Obviously, with other leaders across the state, it feels like something we're all working on together rather than something that can feel like a side project or, you're pushing a boulder up a hill. Like the actions of state leadership can really help to bring momentum to the issue. So that's something I'm really attentive to and something I think a lot about in the work and something that we're interested in at FAS to how to be a part of that empowering mission of her state leadership. So I'll start there.
I want to go off of what Grace just said. I received a letter from a 12-year-old in Sacramento because she saw a bunch of her classmates get really sick. They were asked to sit outside during a really hot day. And she went online and started researching after that and began to understand the effects of heat illness. And what that really brought up for me is how much work we need to do. I'll hear like a radio jockey talk about, oh, it's so hot in February, isn't this great? and just think to myself, oh, this is crazy. If it's this hot in February, how hot is it going to be over the summer? And so I think one of the first things we need to do is really to make it clear to our decision makers that this is a public health problem, a crisis, I would say. This is getting worse, as Grace eloquently said. Like, our systems, our infrastructure is not built for it. But we should look at this as an opportunity, because many of the solutions that we're talking about in terms of cooler cities also have a mitigating effect as well. So they help to keep the population safe from extreme heat. They also get help to mitigate some of our emissions as well. So we should look at this as an opportunity to reconnect with nature, have cities that reconnect us with what sustains us to begin with.
I'll focus in on the greatest areas of opportunities that I've seen and experienced. I often get outreach from local leadership and also state leadership outside of the state of Arizona, and there is always a laundry list of needs. So I could go on for days about what are the needs related to extreme health. But I try to focus on some of the positive things that we can do and focus on opportunities, the way that we kind of frame things and move forward with. So often I tell individuals, leveraging on the chief heat officer model seen at both local and state levels is definitely something that you can look at and gain experience from, and not reinvent the wheel, but learn from those. Also looking at just integrating heat into existing plans. There's so many governmental plans out there, and they're often getting revamped and revisited, and just making sure that heat is part of that conversation and being considered within those planning and those updates that are being done. One of the things we look at in Arizona is innovative solutions. So always thinking about innovative technology or early warning systems, what you can do to inform and make sure the public are aware, are really important, and looking at what you can do for some next steps and making sure people are informed is definitely that first step going forward. Building community capacity and resiliency hubs. And that's not just about heat, that's connections within that community that can be leveraged, as vaccine clinics or outreach for mental health, for connection to be able to connect to healthcare and healthcare insurance that are available within the community, connections to naloxone and substance use disorder treatments and information and those type of items, and making sure that if you have an opportunity, a cooling center, making sure that you make the most of that contact that you have with an individual to be able to let them know about those different options that are available to them. And then utilizing the economic case for heat resilience often comes into play. And it is unfortunate. I think sometimes a lot of folks get desensitized to just the numbers, but the personal stories and connecting it to the economics that are behind it, or that may be seen in the future, are definitely something that catches people's attention too. But I love this personal stories, like Lisa mentioned, about the outreach there, because it does that connection to humanity. But if nothing else, I tell folks, just start doing something and take that first step. It'll often lead you down a road of finding a lot of individuals that are very passionate about extreme weather or extreme heat within your communities. And that has happened to me within the state of Arizona too. And so that just leads to the next step, the next step, and the next step that you can do and accomplish. Thank you.
Thank you. You all touched on such great points. There's so much work to be done. And as as we realize that Arizona is the leader and you're doing all the right things, there are so many things you're already doing, and states like you are already doing, so we don't have to reinvent the wheel. We can follow some of the, models that are working in states like Arizona and learn so much from states like you. I want to move on to a couple other questions, and I know there are some questions in the chat. One question for you, Dr. Liver. In your presentation, you highlighted how Arizona is implementing a whole of government response to extreme heat. Similar approach in our letter as well. From your perspective as a public health leader, why is it so important for states to take the lead on this issue, and what makes a coordinated cross-sector approach so essential in protecting health? I know you touched a little bit on this question already with your last answer, but if there's anything you want to add on that perspective.
No, I think just taking a look, such as in my case and scenario, extreme heat isn't solely a public health problem. It has a lot of different challenges and facets that extend a lot of different areas within society, and it's a complex problem. Health impacts of heat are influenced by a lot of different factors, right? I think we have social determinants of health, occupation, economic, infrastructure, environmental, and no single agency or sector can address all of those, and nobody can do it on their own, be that at a local or at a state or a federal level. We need partnerships to move forward. States can also help maximize impacts and avoid silos by making connections, such as like what we're doing here today, talking with Lisa and Grace and the entities that they represent, and then looking at where you can go with those as next steps. I think also they can help communities work to reach vulnerable populations effectively and help do statewide awareness, which is a big piece of what we do prior to heat season, is just hopefully educate and make people aware of what's coming, keep people aware of the situation they're in during heat season, and then step back and do an evaluation of our efforts afterwards to see what maybe we can improve, change, or keep going for the next heat season as it comes forward. And I think also advocate for building long-term resilience is absolutely necessary. We spent our first year really focusing on some acute needs that we had within our state. And now we're stepping back and looking, what are those 3, 5, 10-year items that we need to be working on and having our eyes set forward so that we can make sure that our state is in a resilient state moving forward.
Wonderful, thank you. I have one more question for Lisa and Grace, and then we'll go to the question. We have several questions in the chat. I don't think we can take everything, but let's spend a little bit of time here. I know that Federation of American Scientists, Medical Consortium on Climate and Health, APHA, we are all part of this alliance. And with this letter, we have had incredible success mobilizing health and non-health partners. We have already more than 120 partners signed on to our letter. So can you share with the audience what are some of the next steps after the letter gets delivered to the National Governor Association? What is the alliance looking into in terms of like next step?
You want me to take that first, Grace, and then I'll bump it over to you. We're still we've been really focused on the governor's letter and sort of seeing what the energy for that has been. Also recognizing that we're seeing federal leadership unfortunately disappear and federal resources disappear. We are really thinking about a state level strategy from here. And so for the states that are already doing great work, places like Arizona and California, for example, how can we sort of lift up some of the tools, some of the successful policies, some of the successful programs, and help do some lesson sharing for other states that are just getting started on this journey. Within this coalition, we also have Physicians for Social Responsibility. We have Alliance of Nurses for a Healthy Environment. All of us have different groups that work on a state and local level. So there's a real strength here to the organizations that are a part of this to be leveraging FAS's expertise on the policy side with a lot of the folks that we have on the ground to be having those discussions with their decision makers to move policies forward. So that will be our next, is sort of picking some states where we can really deep dive and do some work. And hopefully we reach a tipping point where we have enough states that are doing this. It becomes the norm rather than the exception.
Lisa covered a lot of it. So I think what I will add, and I think this also helps answer some of the questions we've seen in the chat, is like there will be impacts to the federal heat infrastructure and the things that we've seen. That's no doubt at this point. I think as we track the reconciliation bill impacts as well as upcoming appropriation bills, there will be defundings of specific programs. There will be less staff available at the federal level. And so what's more important is how we build networks of collaboration and support that ensure that the best knowledge and expertise is available to people who still want to do good, whether that's inside of government, external to government, in the private sector. And so I think that's another thing that I'm really focused on, excited to work with the Alliance on, is really just to be, a resource base available to folks who are seeking to take action in their various spheres of influence, and really helping to narrow down and narrow in on the actions that we can be taking to get the most impact with available resources and available capacity. A final thing I'll just mention is, again, there are a lot of different people across the country at the state and local level in government who are doing amazing work, folks here on the call, folks that we work with at the Federation of American Scientists, And just continuing to build connective tissue for conversation and collaboration is something I think will be really important in the times to come. And I think building this network is just going to be a boon to their work and benefiting the momentum here. So thanks so much.
Great. And now we can dive in. We have around 11 minutes to dive in and take some of the questions that are in the chat. So one of the question is, there's increasing evidence that tribal populations are disproportionately affected by extreme heat waves. Are there key policy strategies, short-term or long-term, specific to tribal communities to address extreme heat?
I can highlight a little bit about our approach that we've taken since the implementation of the governor's plan in 2024. One of the things that we've done is always had a holistic view of our state, be that urban, rural, or tribal communities, and making sure that there's inclusion in any efforts that we're either doing or developing as we take next steps. Some of the priorities we had was to make sure that we had our touch points with our tribal leadership and tribal partners to let them know about ongoing efforts within our state so that they can have an opportunity in an environment to be able to give input. The other is we reached out and identified specific tribal heat points of contact so that we can make sure that they're included in any messaging, information, or distributions of materials so that they can have that awareness going forward. And as we move forward with our work groups, task forces, and efforts, it is an open and transparent process. So anybody who is a heat-related partner, be it from the urban, rural, or tribal communities, are more than welcome to participate so that we can make sure that we get their input in taking next steps. So that is a stance that we have to make sure that there is that inclusion there, make sure that that awareness and transparency is there. And we're always looking at ways to make sure that we are doing well with that. And if there's any areas of improvement, we're open to feedback too. So hopefully that helps a little bit from our perspective and efforts.
Does anybody else want to add anything?
Yeah, I'll just highlight Linda Helland, who's from California Department of Public Health, dropped a resource in the chat that I'd encourage folks to check out. CDPH does really great work in California as well. So I just want to highlight that research that Linda dropped.
Okay, thank you. One of the question is, do the panelists have any suggestions on how to communicate heat risk that is more chronic, long stretches of unhealthy heat levels, rather than acute extreme heat dome and full-on emergency? Getting public health and other public officials to think beyond official emergency or not emergency to the impacts of long stretches of hotter weather seems somewhat challenging.
I can start a little bit on this one. We are recognizing it is a communications challenge. We have a lot of resources that have been built in the general public health frame about, here are the signs of heat illness, here are the steps that you take. But this gets at a deeper question, which is, how do we build people's consciousness that the world is changing? This is not a threat that used to exist in our minds, and we really need to see it as a threat moving forward, not just in the moment, but in the long term. The Medical Society Consortium, we are based at a Center for Communication at George Mason. And so we are actively starting to do work in this space about strategic communications to get at this, because it requires some careful consciousness building on what messages work, how does it resonate, do we pick populations to really tell those stories, and how do we build this consciousness in the public? There's another study that came out about how they studied residents in Phoenix that had been exposed to that extreme heat, and they saw more rapid cellular aging, similar to a smoker, for example. So we are even the evidence is evolving as to how we're understanding how heat is affecting our bodies, and how do we keep communications up to date so people are understanding these risks. These are all things that we're in the middle of figuring it out as we go.
I think those are some great points that Lisa brought forward. And I think from our end in Arizona, we really lean on our preparedness plan. And we identified what are some long-term drivers and initiatives that we can make recommendations around and be able to see what we can do outside of just those acute needs that happen each heat season. And so we really dived into that and went into 4 primary topics, looking at safe and affordable housing, adapting and updating emergency response within our state, cooling center network and supports, and looking at data sets, knowledge, and workforce development as what we can do to look at those long-term pieces. And I also think when you're looking at telling that story, it's really also having the perspective that everybody has the potential to be impacted by extreme heat. And I think that way you can make that connection and cross the aisle and be able to have that open conversation, which is, I think, even more important now than maybe it was previously on that end too. Just a little bit on that.
Thank you. And I also dropped in the chat, just taking this time to highlight our upcoming training on July 24th. It's open to all health professionals, community leaders. It's a 3-hour training. You can get 3 CE credits. Sorry, just putting the plug in for that training. It's coming up. So one of the questions here is, if a healthy adult sitting in shade, continuously drinking water, can survive temperatures up to 115 degrees with no humidity, how does humidity affect those temperatures? Are there different cutoffs for feel-like temperatures?
I'll just quickly provide the physiology here, and then I might turn it over to Dr. LeVar for some of the cutoffs. But so the way sweating works, right, is that water escapes into the environment around you. But if the atmosphere is already filled with water, the water has nowhere to go. And so the more humid it is, the harder it is for you to sweat. If you can't sweat, you're going to heat up. So the thresholds are lower. And again, it depends a bit on the individual, if how old they are, if they have other medical conditions, if they're adapted. That's another big piece of this. So an athlete, for example, in California, is adapted for something different compared to an athlete in Atlanta, Georgia, where it is hot and humid. All of these things go into play in deciding like what thresholds are potentially dangerous for a population. And then you have to also add in what additional vulnerabilities might be. And I don't know if Grace or Eugene have other things to add to that.
I think that is a great explanation. And I think it's also utilizing tools like NOAA and the National Weather Service heat risk that take into account what may either be a dry heat or a humid heat when they're putting out their heat risk and whether or not it's minor, moderate, extreme, and being able to inform the community off that with some of those variables taken into account. We utilize that and then look at what are the next steps that our communities can be informed and safe and taking those next steps after you experience and get that release of that particular heat warning. So I think it's making sure your tools and what you utilize to help inform the public are very important so that they can accommodate that. I grew up in Texas, and that humid heat is a lot different than what I experience here in Arizona with the dry heat. You don't even have an opportunity to cool off it when you're experiencing that humid heat because that sweat just sits on your skin and doesn't evaporate. Compared to Arizona, when you're in this dry heat with lack of humidity for most of the time outside of monsoon season, right? It evaporates so quickly your body can't keep up, and that's another risk. And then you have the risk of dehydration coming along with it. So it's just being aware of those geographical differences along with the physiology, like Lisa explained, and then making sure the tools that you utilize to inform the public can help make sure that you get adequate warnings out there.
Thank you. I think we have time for one more question. There's the question is, the American Industrial Hygiene Association has evidence-based specific recommendations for workers based on heat index, sun exposure, intensity of activity. They provide work, rest times. Do we have or do we need specific recommendations like these for seniors and others? And what about children?
I'll just add from my end, I think having that information for specific populations that may be impacted by heat is not a bad thing. And I think there are research and studies out there that can help give you some of that information and background, and then looking at how they can be utilized. I think one of the things that came up with the federal OSHA rule, and we heard a lot of comments. I was listening to some of the commentary period where the differences in the regional differences, and that 80 degrees cannot just be a baseline. I think it's same for populations. You cannot just have the stagnant crossover baselines of factors and thresholds across the board. You have to look at them individually and then make sure that your guidance and education reflects that, to make sure that they're getting the appropriate information to be able to make informed decisions that they need to. Just my 2 cents on that.
I'll just say a bit about children, because I've done a lot of work on school preparedness for things like heat and wildfires. And so there's big opportunity to make sure, especially like athletic teams are coming up with heat safety plans, for example, that is based on the region and what those threshold risks are. Becomes, and schools need it too, especially there was a GAO report that showed how many schools in our country don't have air conditioning, don't have adequate HVAC systems, and we're seeing more and more schools called off. There's a flip side to this, however, which is that when we call school off because it's too hot, they might just be going back to a hot apartment, for example, and then they're missing school on top of it. And we are not resourcing our schools appropriately for the climate that we're entering. And so these are, again, to Dr. Levar's point that he made in the beginning, these are really complex conversations, need to be multidisciplinary, need to be balancing all the risks, so that we don't produce a secondary problem trying to solve the first one.
All right, so I think we are right at one. So if there are any last thoughts from any of the speakers, we can take that and then close this meeting. Any final thoughts from anyone? I know we are at one. All right, so before we close, I want to just remind everybody, well, thank you so much for joining first. And then I just want to remind everybody the letter is still open. So if your organization can join us, I think the deadline is July 20th. So please sign on to our letter, keep engaged, keep connected. And again, just want to thank all our speakers here. Thanks for joining us. This has been a great discussion. We will send the recording to everybody, and keep doing the good work. Thank you. Bye.
So much.